Fibromyalgia is one of the conditions that give long-standing pain, and fibromyalgia can be very disabling at a physical and also at a psychological level. From the medico-legal perspective, the relevance of fibromyalgia to a medico-legal claim is that often there has been a trigger for it. The trigger can be a physical trigger, an accident, a stressful episode, stressful event following surgery, stressful event following multiple trauma, but can also be a psychological trigger. And often psychological imbalance, psychological disturbance, or psychological maladaptation can happen when the outcome of an accident, when the outcome of a surgical procedure has not been what we were expecting, and things do take a lot longer to settle. Patients start suffering, the suffering starts to affect them psychologically, the psychological effect of the suffering then leads to the symptoms being felt at a much higher level, much worse, more disabling than they really are. But that's a genuine complaint. It's not that by feeling them worse than they really are, that means that they are actually making it all up. It can be a very genuine feeling of worthlessness that will not allow you to see how you can come out of that situation. And often that is accompanied by very severe levels of pain. So typically the symptoms of fibromyalgia will start with pain that starts in one area and slowly creeps up more towards the core of the body, and often will evolve to spreading throughout the whole body. So the symptoms of fibromyalgia, as far as pain is concerned, is effectively pain everywhere. If we divide the body into 4 quadrants over a period of time, we tend to say about 3 months, there has been pain somewhere in each one of those 4 quadrants. There cannot be anything else that explains it, and often the pain will be accompanied by other symptoms which are more psychological and which will involve difficulty to be able to sleep, difficulty to concentrate, difficulty to take decisions, difficulty to take charge of your own life. Effectively makes life very difficult. There will be other associated symptoms, tummy cramps, headaches, depression, insomnia, tiredness, fatigue, lethargy, and those can be some of them as a consequence of the severe levels of pain, but some of those symptoms are primarily because of the fibromyalgia. The way that we tend to diagnose it is with a diagnostic screening tool which is designed to assess initially how widespread the pain is, and that we do that by asking a series of questions and assessing how many of those are positive. The second part of that screening questionnaire involves looking into how that distributed widespread pain is affecting the person at a functional and psychological level, including their ability to sleep, including their ability to function in the morning, and how their mood is at a given time. And it is a combination of different scoring systems within those lines that we can establish a potential diagnosis of fibromyalgia, providing that there is nothing else that explains it, in order to meet the last criteria, we have to do some tests sometimes to exclude vitamin D deficiency, to exclude inflammatory rheumatological conditions, to exclude thyroid problems that could be treatable by other means and give similar symptoms that by no accounts relate to fibromyalgia. There's a second way to diagnose fibromyalgia which involves prodding and poking, which is the tender points. Those tender points are distributed again throughout the 4 quadrants of the body and involve prodding with a finger those areas to see how many of those are painful. The difficulty with this way of diagnosing fibromyalgia is that although the description of these tender points was very specific as to how much pressure ought to be applied in order to find out whether a point was actually tender or not, that pressure is actually very difficult to deliver with the tip of the thumb or the index finger. And it's very easy to get into a situation where you can almost give the diagnosis of fibromyalgia to whomever you want. You only need to press hard enough and they will jump in pain.